Well, thank you for staying with us. We've been sharing some tips on the coronavirus, something that we've been doing for a while now. We've been talking about the fact that there hasn't been any suspected case in Ghana yet, but this morning we're all waking up to the news that there are some 2 persons being held at the Korle Bu Teaching Hospital who have shown some symptoms that look like coronavirus, but the test has not been proven yet. Our colleague Fred Smith joins us. He's head of our health desk. He's been to the Korle Bu Teaching Hospital just this morning. First of all, Fred, tell us what's new about the virus.
Well, globally, we had the highest spike yesterday. 73 people died, and that's the highest we've had in a day since the outbreak in November. And so it's brought the total number to close to 600, and that's also something that the Chinese people and the WHO are worried about. Once interventions were introduced, we expected the cases to go down and eventually completely eliminated, but it doesn't appear to be that this is actually reducing the infections.
Yeah, you went to the Korle Bu Teaching Hospital this morning. Explain why you went there first of all and what you saw.
Well, late last night, we had information here at JoyNews that 2 men were being held at the Korle Bu Teaching Hospital because they had signs of coronavirus, and so doctors there, they walked in themselves. Doctors there thought that it would be safe to refer this matter to the Noguchi Memorial Center for Medical Research, and they are to test samples that they took from these men if they show signs of, if they are indeed coronavirus. What happened was that these 2 men complained of headache and neck pain. The 2 of them, they are friends. One of them is Chinese, but he's not been to China since September last year. The other is Argentine, but he's been to China in the last 2 weeks.
Okay.
And so it's unclear if that will be. Now, what the health professionals will look out for if they suspect you to be having the coronavirus, you should have fever. That's the main thing. It's the reason why your temperature is very crucial. They check to see if you've gone past, the WHO says 37.5, then it should be a matter of concern. Then further checks will be done on you. Yeah. But these people do not have high temperature. The 2 don't have high temperature.
But do they have muscle pains?
Yes, they only complain of neck pain, which is unusual. And because this coronavirus disease is new and very difficult to understand at this point,
so they're still studying it.
They're still studying, and if you notice, we still don't have an official name for it. What we used in 2019 nCoV is just a generic name, just to have it just to have some kind of description for it, but really
because of relatively the family with which the virus was
indeed, so it's just a family name.
Yes, just before you go on, there's also the fact that they reported of malaise, which is general discomfort and uneasiness, and then flu-like symptoms as well.
Well, I've spoken to the head of disease surveillance at the Ghana Health Service, Dr. Sedu Bakwen, who has indicated to me that they did not show sign of this flu, and so we will all have to wait for the tests at Noguchi, which we expect to come in around midday today.
Okay. Roland.
We're told that we have at least 17 sites that are supposed to be the main focal points if there should be any outbreak, or where people could go to and have those tests undertaken. Is Korle Bu one of them?
Korle Bu is not one of them,
so
and
were they prepared?
That's a concern for some of them. But considering the fact that Korle Bu is the biggest teaching hospital we have in Ghana at the moment, there still is a holding room where at least these 2 people have been kept, so that investigations will continue till this afternoon.
But I'm wondering, how did they get in? Where did they go through?
Who have they been in contact with?
Who came into contact with them? Like so many questions that we're asking.
So what the health experts, the Ghana Health Service wants to do now is to do contact tracing, to find out who they are friends with, who they've been dealing with in the past. But the information is that they came in an Uber. And so the Uber driver will be crucial in this. We need to get him back and to also test him to see if he's okay.
So that contact, just like they would do, and I remember the British reporting that what they did was, apart from the tracing, they tried also to have some public announcements. So are we also going to do that? Maybe
I'm not sure what strategy they're going to use, but definitely some contact tracing is going to happen. And the experts, I do understand, are gathering this morning at the Korle Bu Teaching Hospital, where some steps will be taken to resolve this matter.
An important aspect in the spread is the rate of travel. And it's also crucial that this has pointedly been the case in these suspected cases. Then, have we had a strict contact being made with officials at the entry points?
Well, I don't know at this point whether that contact has been made, because this thing happened very late last night. And so, but should they decide to do, the records are available. You recall, I was at the Kotoka International Airport, and so any passenger coming in to Ghana will have to give records of themselves and their travel history, where they've been to, and all of those things. Those records are available at the Port Health of the Kotoka International Airport, and so if they decide to trace it to that point, it will be. I'm sure that will be very important after midday, when we've known what the Noguchi test results are.
There are also questions about if the Noguchi Memorial Institute is resourced enough to also carry out these tests to confirm whether or not when we have symptoms looking like coronavirus.
We heard on Sunday that the Noguchi Memorial Institute for Medical Research was taking delivery of some test kits. The health minister also in Parliament 2 days ago announced, was yesterday, announced that they were, allocating in excess of 2 million Ghana cedis to help procure PPEs, masks, and the others to help protect them. So no one can say for now if we are fully prepared for it, but at least some steps have been taken, and I believe, in the light of our position that we have not so far recorded an outbreak yet, we should be in a very comfortable position to handle any of such issues, especially the two that we have. We should be comfortably handling them. Yeah,
it's interesting, because you monitor Kenya, South Africa. When we have suspected cases in itself, cases that we suspect could be, it's news enough. And I guess that's why the BBC is even reporting on this Ghana case.
Indeed.
When we had the Ivory Coast for a very long time, I think it took a couple of days to confirm that, the test was not positive. So people are going to be looking at us for a while now.
Indeed, it puts all of us on tenterhooks. Once in fact, this test result could prove anything, positive or negative, and so the country is currently on tenterhooks waiting for what results Noguchi would be producing for us today. Until then, we can only stay positive and observe the precautions that the WHO and the Ghana Health Service have told us to observe. For instance, stay about a meter away from someone if you're having a conversation. Do not, if you have headache, you need to be suspicious. If you, for instance, have running nose, be a bit suspicious.
If you're coughing,
be suspicious and see a health practitioner, go to a hospital. And for instance, if you suspect that you would have come into contact with a surface that may be infected, wash your hands under running water with soap and those things. And if you get sanitizer, it will be good to apply it from time to time. All of these will help you to stay safe.
Great. Fred Smith, we know you'll be following up on this suspected case at Korle Bu Teaching Hospital, so you come back to us as soon as we have any more information to share with our viewers. That's the head of our health desk, Fred Smith, with details as he visited the Korle Bu Teaching Hospital this morning on the news that 2 persons are being held suspected to have the coronavirus. But the test, remember, is not, we don't know if it's positive or negative. It's still being tested, and it is still very much a suspected case. It doesn't mean we've recorded any incident yet. Stay with us. It's still the AM show. When we return is Ask Info Ministry. Kojo Ponkroma, the Minister for Information, is our guest here on the AM show. Keep your questions coming through.